When we call 911, we expect help to be there. It's the EMS agency that handles the daunting task of ensuring that it is for Los Angeles' 10 million residents. And now with a new system in place, potential heart attack patients are getting care better and faster than ever before. I'm your host, Rachel Bozing. Welcome to My County, the show that explores services and programs provided to you by Los Angeles County. Joining me today is Dr. Bill Koenig, the Medical Director for the Los Angeles County Emergency Medical Services Agency. Welcome.
Thank you. It's my
You know
pleasure.
what? This is actually a really fascinating topic because this is a net for 10 million residents, 600,000 calls a year, and
Well, it is a huge system. It's got 74 hospitals in it. It's got over 30 paramedic providers in it. It's got hundreds of mobile intensive care nurses and hundreds of emergency physicians, all of it called into play when you dial 911.
so the minute you call it, they all jump into action.
Well, not all at once.
Right.
No, but they're all ready, you know, and that's what's amazing. 24 hours a day, 7 days a week, 365 a year. We have systems in place for different things. Heart attack, trauma patients, that's basically injured type patients, patients who are stroke. Now we have a new program, and all of those have systems in place whereby hospitals are designated by the EMS agency to receive those specialty patients and take care of them immediately.
And the cool thing, of course, is that mostly when people are dialing 911, time is of the essence. They're scared, they're terrified, time counts, and how does that go into play with all these different arms?
Well, I sometimes, let's talk about a heart attack victim.
Yep.
You have a heart attack, it's like a relay. The patient actually starts the relay, blows the whistle, fires the gun that starts the relay going. And that's really incredibly important, I think, that patients are the beginning of this. If they delay the start of the system, then oftentimes that time is wasted while they're at home watching TV, wondering whether they're having a heart attack.
Right, or
when the system
indigestion
could
or
be,
something.
Yeah, the system could be working.
Now, you found out that there's a way to really be effective in identifying that this person did have a heart attack or they're about to, and that you've put in a whole system in place to answer that. Tell me about that.
Over the last 10 years, it's become increasingly clear in the medical literature that the way to treat a certain set of patients that are sustaining a heart attack is to really get them into a cath lab in a hospital that can do a cardiac catheterization, and that's putting a wire up into the heart. If that's done within 90 minutes of the time the heart attack starts or the time the patient gets to the door of the emergency department, that's been shown to increase the survival and decrease the amount of heart muscle loss.
So you guys spent $5 million to do what?
Well, we spent
more than that.
We spent more than that. but we spent approximately $5 to $7 million getting equipment into the hands of the paramedics so that when a patient calls the paramedic system, the paramedic is able to put a machine on them, an EKG machine is what it's called. And a lot of patients know what that is. It gives them a heart wave, and when that heart wave shows that it's a type of patient that should go to one of these hospitals, there's a system activated. And that system notifies the hospital calls the cardiologist, the emergency physician is ready, the cath lab team starts to come in at that time, and they respond to the hospital. And oftentimes by the time the patient gets there, the team is ready for them.
It's like a symphony.
It's like a symphony. And you know, what is impressive is this happens 2,000 to 3,000 times a year.
And you've reduced the time from 2 hours down to an hour and a half, and that 30 minutes, critical.
The Heart Association has guidelines based on the national literature. Those guidelines really set very specific time frames for the treatment of these patients that have a heart attack. We saw when we went out initially and surveyed hospitals that while a lot of them were trying to do this, it really took the system to get into place for the hospitals to reduce their time. And so once the paramedic was able to put these ECGs on the patient, call the hospital and say, we've got a patient that's going to meet your criteria. They didn't have to wait till they got to the emergency department door. They were responding while they were still in the field.
And is that what's called the balloon to door time? Is that
door to balloon?
Door to balloon,
yes,
other way around.
Yeah, it's pretty much the same time, just a different direction.
So what you're referencing is the door to balloon is how long it takes from the time somebody calls to where they actually...
We measure all of these intervals, and the EMS agency keeps a database, but the interval that really is measured is the door of the emergency department to the time the balloon opens up that artery in the heart. And when the heart artery is opened up, the blood starts to flow, the muscle starts to breathe, in essence, and you save muscle. So, and it's the same way, quite frankly, for brain also. I mean, the neurologist will say time is brain with stroke. We don't quite have the same interventional modalities with stroke patients, but the cardiac patient has become very clear, and we're able to intervene very quickly with those patients.
And this is something that's relatively new, relatively recent for the EMS, or?
Last 3 years
Okay.
is when this system has been in place. We started out sort of with, initially in December of 2006 with 3 hospitals, and we now have over 33 hospitals participating.
So this is part of that kind of way to reduce time and make the entire system work a little faster. Another one of those ways, and I think you kind of touched upon this a little bit, is that you've got designated hospitals for designated things.
Yes. Our system, the concept is what we call regionalization. That is, we have 74 acute care hospitals. They don't all do everything. Mm-hmm. And so we have identified, for example, hospitals that will take care of trauma patients. If you get in an automobile accident, you're not going to necessarily go to the nearest hospital. You'll go to the hospital that's a designated trauma hospital. That hospital will have a surgeon, emergency physician, an emergency team, and an operating room ready if you happen to need an emergency operation. We do the same thing with heart, and we're now doing the same thing with stroke patients.
And something else that I found interesting was that you said for people, they should, sometimes people think, oh, if I call 911, I'm going to a specific hospital. But because hospitals are designated, they shouldn't take it upon themselves to choose which hospital they're going to.
They have to be very knowledgeable to choose the right hospital. And what we have shown, and it's been very interesting, is that if you come in by 911, let's say with a heart attack, it will actually prompt the system faster than if you walk through the door of the very same hospital.
Good to know.
So good to know that if you have a heart attack, calling 911 is probably going to prompt your care even faster than if you got in the car and drove to the hospital, which we don't recommend.
Right.
But, you want to call the paramedics, have them put that machine on you, have them diagnose or see those EKG machine changes, and get you into the hospital as quickly as possible, notifying the team that you're coming.
Thank you so much. I really appreciate you being here. Of course, if you want to learn more about the EMS system, you can go to our website, which you're going to see below on this screen. And thank you for joining us for My County. And be sure to tune in next time, where we'll tell you more about the programs and services brought to you by Los Angeles County.